Hi, I'm Victoria, and today I'm going to be speaking on mental illness in community corrections. 1 in 7 people who are involved in the criminal justice system are known to have some form of mental illness. A common idea is that crime involvement is related to mental disorders, and I believe there is need of support for these individuals who are stepping out of incarceration and into community supervision. A criminalization hypothesis I'd like to speak about is how individuals with mental illnesses tend to become more involved in the criminal justice system due to their symptoms related to their undertreatment or untreated mental illnesses. This explains how important it is for community corrections to grow these specialized treatments. And when individuals fail their probation or parole, they're just getting dragged deeper into the criminal justice system, and this disrupts their growth and treatment plans. And the main focus of this treatment should be the offender's chance to achieve their goals, improve their quality of life, and reduce their likelihood of reoffending. Specialized caseworkers. So for one, there's specialized units of officers that have smaller and more exclusive caseloads. These officers will also have specialized training to help offenders with their mental disorders, and this specialized training will go on throughout the officer's career. Collaborative community agencies. It's important that among the community of these workers, they share systems of how they secure resources for individuals, and they work through these agencies to have a more effective way to find treatments, housing units, public benefits, and other things needed for these individuals. And problem-solving methods is used to engage their offenders in compliance with special conditions of their parole or probation. And it's important to understand that the focus should be on to maximize the potential for helping these individuals with mental disorders live and function effectively in the community. Now we're to speak on the difference between how specially trained officers work primarily with offenders with mental disorders differ from those who have regular cases. First is the amount of knowledge and support for mental health approaches. It would make sense that these officers who are specially trained would be more knowledgeable in the field of these resources and how to help their clients. Then is the relationship between the officer and the offender. These relationships are going to differ because they need to have an emphasis on how to achieve treatment compliance. And these officers are to be working more directly with the treatment provider and the individual to make sure that they're getting the help that they need and that they're going through the process correctly. Then is going to be the view on mental health treatment and how effective it is as a component of community supervision. There's also going to be more time dedication and routines created for these individuals to help with the effectiveness of their community supervision. And it can be seen that clients with mental illnesses who are part of these specialized cases tend to have different needs. Now we're going to talk about the improvement seen. The results seen from applying specialized caseloads is that they generally do support and help the effectiveness of community supervision for offenders of mental disorders. It can be seen that these clients who are part of the specialized cases have fewer violations and spend fewer days in jail. And for the most part, they have improved mental health outcomes after around 6 months of the supervision. This helps them become more successful and become part of the general public again. Now we're going to discuss the labeling theory. Labeling theory is how individuals know themselves based on the way that other people label them. This has been seen in mental illness due to the stigma that is associated with mental illness and how it's surrounded by a negative stereotype since it's misunderstood by the public. Public stigma is the behavior of a person in the general public, and self-stigma is related to the internalization of the stigma seen by the person with the mental illness. This can cause some self-image issues for the offender and cause them to act out and feel that they can't change the path that they're on. Offenders who deal with mental illness should receive the correct treatment needed and be able to lose their label in the community since the community correlates their mental health problems with their criminal behavior.